Suicide warning signs and prevention strategies for older adults. According to the U.S. Census Bureau, older adults age 65 and over represented 16% of the total U.S. population in 2019. And in 2020, older adults ages 50 to 85 plus accounted for 19,968 deaths for a crude rate of 16.86 per 100,000, according to the Centers for Disease Control and Prevention. Recognizing that this population is disproportionately affected by suicide, it's critical that we address suicide prevention in this group of Americans. Baby boomers, those born between 1946 and 1964, have had a relatively higher suicide rate at any given age than earlier or subsequent birth cohorts. Demographers estimate that by the year 2030, over 71 million Americans will be 65 or older, or 20% of the U.S. population. Baby boomers are a group with a historically high rates of suicide as they enter older adulthood. It's anticipated that the rate of suicide in men and women will rise again. Older adulthood is a time of greatest risk and could result in substantial increases in the number of senior citizens dying by their own hands. Collectively, older adult caregivers, the health community, government, and non-government stakeholders, and the general public alike can change that trajectory. In order to intervene, healthcare providers and caregivers must be able to recognize the warning signs of suicide in older adults. Being aware of certain behaviors that can indicate thoughts of self-harm may help save a life. The SAMHSA website has published warning signs that may indicate someone is at risk for suicide. These include talking about wanting to die or kill oneself, looking for a way to kill oneself, talking about being a burden to others, increasing the use of alcohol or drugs, acting anxious or agitated, and behaving recklessly, sleeping too little or too much, withdrawing or feeling isolated, showing rage or talking about seeking revenge, and displaying extreme mood swings. Mental health providers should have an early career training in suicide prevention, suicide behavioral interventions, and suicide postvention. Graduate students in social work, psychology, counseling, and even gerontology often do not receive adequate skills training. As a result, too many providers with graduate degree preparation are learning on the job how to support individuals with suicidal ideation and or post-suicide attempts. One example of a prevention strategy that can help reduce suicide attempts among older adults is to increase healthcare provider awareness of substance use and mental health conditions in older adults. To achieve this, evidence-based screening tools can be used in clinical settings to screen for suicide risk. A critical national resource for those experiencing crisis is the 988 Suicide and Crisis Lifeline. The Lifeline is available 24/7 and connects mental health professionals to those in crisis. Safety planning is another important tool to prioritize coping strategies and sources of support for individuals. These tools offer wide-ranging guidance on older adults and suicide prevention, substance use, program best practices, and clinical support. While observing a single warning sign may not indicate thoughts of suicide, noting multiple signs and/or risk factors, major life events, medical prognosis, and/or mental health diagnosis could indicate suicide risk. There are many strategies that can be used to prevent a suicide death among older adults. And lastly, providers across mental health disciplines can refer to resources that reinforce best practices, including SAMHSA's Promoting Emotional Health and Preventing Suicide, a toolkit for senior citizens, and the CDC's resource, Preventing Suicide, a technical package of policy, programs, and practices.